The Prescribe Safe series is an ongoing series of podcasts where we learn about how clinician and administrative leaders are navigating pressing healthcare issues to help stem the tide of the opioid epidemic. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, senior writer at AHA's Washington office, and your podcast host. Today, Rebecca Chicky speaks with Dr. Casey Grover, who, as an emergency room physician at Montage Health, is on the front line working to address the opioid epidemic. We'll be discussing how, in his experience, relying on complementary and alternative medicine for pain management can help reduce dependency on opioids.
Welcome to another in the American Hospital Association's ongoing series of podcasts, where we learn how clinician and administrative leaders are navigating pressing healthcare issues. I'm Rebecca Chicky, Director of Field Engagement, and our section for Psychiatric and Substance Abuse Services. Today we are talking with Dr. Casey Grover, who, as an emergency room physician for Montage Health, is on the very front line working to address the opioid epidemic as part of Montage Health's Prescribe Safe Initiative. We'll be discussing how, in his experience, relying on complementary and alternative medicine, or CAM, for pain management can help reduce dependency on opioids. Welcome, Dr. Grover, and thank you so much for talking with me.
Absolutely. Thank you for having me today.
First, tell me a little bit about yourself, your current role, and what drew you to the Prescribe Safe Initiative.
So, my name is Casey Grover, and I'm an emergency physician with Montage Health, and the hospital I work for is Community Hospital of the Monterey Peninsula, which, believe it or not, is a community hospital on the Monterey Peninsula in sunny California. I'm also the medical director of our emergency department here, and I'm also the physician champion for the Monterey County Prescribe Safe Initiative. And what actually drew me to the Prescribe Safe Initiative was working with my colleague, Dr. Reb Close. She also has been on our webinar and presented on some of the podcasts, and it was truly her initial idea. But practicing in the emergency department, a shift does not go by where you see someone who suffers from chronic pain, medication mismanagement, or addiction. And so, in a kind of selfish way, getting people better care and reducing the burden of these conditions on our community actually made my shifts in the ER better and easier. However, more importantly, as I mentioned, this is a significant burden on the members of our community and also nationwide, of course. And it was really the potential to affect positive change in my community that made me want to get involved. And I'm very grateful to say we have been able to make a significant positive improvement in our community.
For those who are not familiar with complementary and alternative medicine, can you describe what that is comprised of, as well as what types you use in the Prescribe Safe Initiative, and how did you integrate them into the Prescribe Safe Initiative?
Best way you can think of it is it's the type of care that you would get outside of a regular doctor's office. So when I think of a regular doctor, I think of shots, I think of pills, I think of surgery. We're talking about traditional Chinese medicine. We're talking about chiropractics. We're talking about holistic medicine. We're talking about homeopathic medicine. It's really kind of anything out of the traditional purview of Western medicine. And the field is enormous. I will say that probably the most effective thing we did in doing it in Monterey County was to actually ask our medical providers for who they had faith in. I think there's always kind of been a little bit of some skepticism by people about non-traditional or non-Western medicine, that it's snake oil or it's smoke and mirrors or it can't really work. But I think when we went through and basically asked ourselves, my ER nurses, my ER technicians, my ER physicians, who do you like and who do you trust and what disciplines do you use, we came up with a trusted list of providers, which has really helped. So what we started with, like I mentioned, was just collecting a list of people who were complementary and alternative medicine providers to give to our patients in the emergency department. Hey, this is my chiropractor's information. He does great work. When my back is hurting like yours is, my chiropractor really helps me. Or, for example, I have a torn labrum in my left shoulder, and my acupuncturist did wonderful work in helping me rehabilitate from the injury. And I tell people about that all the time when I'm taking care of them in the emergency department. Additionally, it can be kind of more simple stuff like aromatherapy. Hospitals aren't really known for smelling good, and a simple, pleasant aroma can be helpful to promote relaxation. Our hospital does a lot of work with music therapy. The other day I was working in the ER, and a harpist sits down in one of our hallways and begins playing music. And when you're in severe pain, even just a little bit of a ray of hope that something relaxing is around you can do wonders to relieve some of that pain. What we are beginning to learn about pain is that pain, stress, and anxiety are extremely tightly linked. Anxiety functions almost to prime the nervous system for a lot of activity of the nerves, such as when a person has pain, anxiety amplifies that pain. An example might be a fearful child of a shot withdraws to my touch as though it's painful because they're so anxious about the possibility of receiving a painful shot. Similarly, a patient in severe distress, fearful of continued pain, is going to be anxious, and that's going to amplify their pain. It's really anything that can be done in the hospital environment to reduce stress, anxiety will contribute to pain relief. Additionally, we also learned that physicians, like myself before starting on this, really don't understand very well what these types of providers do. For example, before being an acupuncture patient, I didn't know how fast acupuncture worked, how many sessions were needed, how long each session was, how to refer, what conditions I could refer for, what insurance would cover it, and on and on and on. And one of our community leaders in medicine in Monterey County, Dr. Jim Gilbert, has led us in sitting down at the table with some of our complementary and alternative practitioners to say, let's take a half an hour, you educate us on what you think we need to know, and then let's make some simple guidelines that we can hand out to all the medical practitioners in the community for some quick, easy education to make it more accessible to patients.
That's excellent. I can definitely say I have a story as well about using complementary and alternative medicine on a shoulder injury. It was incredibly effective, and I walked away without surgery or pain meds or shots.
Absolutely.
Tell me this. Are there any lessons learned in this process as you have worked through the many steps that you've described here that you'd like to share with others? The one thing when they start trying to integrate complementary and alternative medicine into their organization, particularly as it relates to trying to reduce the impact of the opioid epidemic, what are the lessons that you'd like to share with the listeners on this podcast?
So I think the first thing is, from a medical practitioner standpoint, we have to realize that each discipline perceives the human body differently. For example, I am an MD. I trained in Western medicine and then emergency medicine at UCLA, and I have a certain way that I was taught to look at the human body and understand how the human body works. When an acupuncturist looks at the human body, they think of things very differently. They look at how energy flows and where energy stagnates, and they talk about organ meridians, and it's different. And I think initially our reflex as traditional medical providers or even patients that are more familiar with Western medicine is to say that the acupuncturist is wrong. And I don't think that's helpful. I have found it is more helpful to have an open mind and to realize that they were taught to understand the human body differently, and they can still be successful in treatment even though they perceive how the human body works differently. And that was my experience with my acupuncturist. I kept thinking, my shoulder hurts, I need to ice it. And she kept telling me, Dr. Grover, you need to use heat. Your energy is stagnating. You need more blood flow. And I honestly didn't really understand what she was saying, but I trusted her that in her discipline, she is well trained, and I will trust that her discipline has taught her to provide relief. Additionally, I have had a number of patients tell me, oh, my chiropractor said that I dislocated my rib. And as an emergency physician, I'm thinking, you dislocated a rib? Man, that sounds bad. I mean, gosh, that's probably going to require some surgery. And chiropractors use the word dislocate or subluxation differently than we use it in traditional medicine. And so I think sometimes we as practitioners kind of have this, well, they don't know what they're talking about because their language doesn't make sense in how I understand things. And I think having an open mind that every specialty does things slightly differently is really important. The other thing I would say is that an open mind makes a huge difference, both as a patient and also as a provider caring for a patient who receives complementary and alternative medicine. My joke in the ER is always, sir, if you told me that putting mayonnaise on your left ear helped your pain, I'm going to encourage you to do that because it doesn't really have any side effects minus a greasy ear, and you're telling me it's helping you. So if as a patient you go to an acupuncturist thinking this is never going to work, there's a high likelihood that you're not going to get a good benefit. Almost kind of a reverse placebo effect, if you will. And as a practitioner, if you tell your patient, acupuncture, forget it, that's never going to work, your patient's going to go in with a bias. So I think from my perspective, approaching complementary and alternative medicine with an open mind as a patient and as a provider really helps us to give it the best opportunity to work. And really, as I see it, any improvement in function and decrease in pain is a win. And as it pertains to opioids, even if we reduce a person's dose by 1 or 2 pills a day, that's still a small win as it reduces their side effects and potential for overdose or interaction with other medications.
So now I'm going to give you a magic wand as we bring this podcast to a close.
Okay.
If you could change one thing, and just one thing, about our healthcare delivery system, their views, and our responses to pain management, what would it be?
I think the biggest hope I would have for improvement would be to break the iPhone effect, meaning with our current system of smart everything, smart phones, smart toasters, smart cars, we're so used to getting everything quickly. I mean, if you think about it now, when you wait for a text message, 30 seconds feels like an eternity. And you think, really, 30 seconds? 10 years ago, that was the fastest response you were ever going to get. And unfortunately, it's bled into medicine, meaning there's an expectation, and I understand it, of course, that people want to get better, and they want to get better fast. And a lot of good pain treatments take time. For example, with my left shoulder, I was looking at shoulder surgery, which in theory is a quick fix, but recovery from shoulder surgery was going to be 9 months. However, with acupuncture, 10 sessions over 3 to 4 weeks drastically reduced my pain, but it took time. And I understand when people are in severe pain, we can use medications to get them to where the pain is tolerable. But thinking about recovery from pain as a healing process that takes time and kind of putting one's expectations appropriately in that framework really helps to help patients kind of feel most satisfied and most able to kind of understand the trajectory of the natural course of illness and not be so disappointed when they don't get immediate results.
Well, Dr. Grover, first, as we close, let me thank you for your willingness to share your insights, your experience, your inspiration. As we all know, too many lives are being lost to the opioid epidemic. So we very much appreciate your initiatives in Monterey, but your willingness to share those lessons learned across the country.
Thanks very much. I appreciate the opportunity.
I want to let our listeners know that in addition to this podcast, there are 2 other podcasts that will be made available. One where we are speaking with Dr. Close. Dr. Reb Close speaks about the importance and the value of collaboration and how collaboration has made the impacts of the Prescribe Safe Initiative much broader and offers a shared responsibility and a shared commitment across the community. Additionally, please check out our March 12th webinar, where there is an in-depth discussion of the Prescribe Safe Initiative start, the impact it's made, and its goals. There will be 2 other podcasts that will be made available, one that is a deeper dive into the funding of the Prescribe Safe Initiative, and the other is a deeper dive into the value and the importance and the contribution of the collaborative that has helped contribute to the success of the Prescribe Safe Initiative. If you want to learn more about the work that the AHA is doing to address the opioid crisis overall, please visit us at www.aha.org/opioids. Thank you so much.